Welcome to Better Health Guy Blogcasts, empowering your better health. And now, here's Scott, your Better Health Guy. The content of this show is for informational purposes only and is not intended to diagnose, treat, or cure any illness or medical condition. Nothing in today's discussion is meant to serve as medical advice or as information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority.
Hello, everyone, and welcome to episode number 71 of the Better Health Guy blogcast series. Today's guest is Dr. Robert Rowen, and the topic of the show is ozone. Dr. Robert Rowen graduated Phi Beta Kappa from Johns Hopkins University in 1971, followed by medical school at the University of California at San Francisco in 1975. He is board certified by the American Boards of Family Practice and Emergency Medicine. Dr. Rowen is affectionately known as the father of medical freedom for pioneering the nation's first law protecting alternative medicine in 1990 in Alaska, and he also served on the Alaska State Medical Board. Dr. Rowen has a practice in Santa Rosa, California with his wife, Terri Su, MD. Together, they have over 66 years of experience in the field of integrative medicine. They have attended medical meetings and traveled worldwide to share their knowledge and experience, especially in the field of oxidative medicine. And now, my interview with Dr. Robert Rowen. Ozone therapy has been a very useful tool for many dealing with things like Lyme disease and related conditions, and was useful in my own personal recovery from Lyme disease. And so I'm very excited today to have a leading expert on the topic of ozone therapy to talk with us today, Dr. Robert Rowen. Thanks for being here today, Dr. Rowen.
No, it's an honor that you would have me.
Thank you. So what drew you into the world of integrative and alternative medicine? Did you have your own health challenges that kind of led you to practice the way that you do today?
Actually, no. I've been blessed with good health. What happened was I've always been an environmentalist. I believe in a clean, safe environment. And in medical school, at the end of my third year, I just came to see, this is in the 70s, that we were doing to our patients what we're doing to the planet. We're just polluting them with chemicals, foreign chemicals. And I did not see my patients getting well. I just saw Band-Aid approaches. Despite all the money that was being spent, they were just getting maintained at their current level of disease. And I almost quit. I got really depressed. And I had so much time into it after 3 years, I said I might as well finish. But I vowed to myself I would always look for a way to treat the patients better than we were treating the planet. And one thing led to another, and I was able to virtually abandon pharmaceutical medicine. And when I say virtually, I think there is a place for drugs, but I think it's about 10% of what they're used for.
Let's start with a real basic question for listeners, which is, what is ozone, and what is the difference between ozone and oxygen?
Great question. They're all made of the same atoms, oxygen. The oxygen we breathe out here is O2, one atom hooked together. Ozone is made by ultraviolet energy or electrical energy splitting apart the weak bond between the two oxygens, and one of them goes careening off and smacks into another O2, and it forms what we call a metastable molecule of O3. They hook together. It's not stable, but it lasts, half-life's about 30 minutes. And it is the most powerful, naturally occurring oxidant that known to man. Only fluorine, F2, is a more powerful oxidant, and it won't exist at all in nature, and it can only be man-made. Ozone does exist in nature. We have an ozone layer in the upper atmosphere, which shields us from ultraviolet energy because it absorbs it. As I said, there's a constant splitting of oxygen to make ozone, and then the ultraviolet energy is absorbed, thereby protecting us so that there can be life on the planet.
So when someone is potentially interested in ozone therapy, before they start using ozone, are there any contraindications, any specific tests that need to be performed to make sure that ozone would be safe for that person? And if so, how common is it that someone may not be a candidate for ozone therapy?
It is uncommon that they will not be a candidate. Very uncommon. Some people believe that hyperthyroidism is a contraindication. I know people who have done it in the face of hyperthyroidism. Generally, if somebody has just had a heart attack, I wouldn't touch them. They have to be in the hospital. Strokes, we've treated immediately afterwards, and we can get very good results with stroke. There might be some other sporadic reasons not to do it. Some people are concerned about a genetic condition called G6pd Deficiency. None of us involved with ozone over time have ever seen a problem with that. Whereas with vitamin C, yes, you can get into real problems with that. So if I was going to do high doses of vitamin C, I would check. Typically, if I'm going to involve somebody in an aggressive ozone treatment plan, I do like to get a blood count and blood chemistry. If they're very anemic, I probably won't do it because I want a reasonable blood count. So when I say if they're very anemic, my cutoff generally is they need to have a hemoglobin of 9. I've done it lower than 9, but with caution.
And then what about, people talk about certain genetic SNPs that may lead people to have higher levels of hydroxyl radicals or free radicals. And then they suggest that maybe ozone may not be appropriate if you already have a high level of oxidative stress. But is that true? Are there certain genetic SNPs that maybe you need to be more cautious about or no?
Personally, I don't believe it.
Okay.
And ozone strengthens the so-called antioxidant system. It's like pumping iron. You make muscle by breaking it down and building it. Ozone does the same thing. Ozone exercises the antioxidant defenses of the body so that you are more powerful against these so-called free radicals. And I want to make something really clear. The free radical theory is garbage. There are free radicals in the body. We need them for life. And believe it or not, 5% of the oxygen that you consume right now gets converted to the free radical superoxide. 5%. There is a constant flux in the body of what we call reactive oxygen species, which are essentially free radicals. Now, there are some that are overtly destructive. It is believed, at least this is now from my understanding, that the hydroxyl radical, OH, is very destructive. But superoxide is absolutely required for normal bodily functioning. There's also something called Singlet Oxygen. When we talked about oxygen, you have O2. This is a stable molecule, and I'm going to prove to you how stable it is. You can mix gasoline with oxygen in an internal combustion engine, but what do you need to make it go? You need a spark. So the oxygen itself is stable. It's not explosive with the gasoline unless there's a source of ignition. Even in a gas leak somewhere, you need to have a source of ignition. That means a spark. And then boom, it's gone. Singlet oxygen is oxygen that is activated. It's carrying the spark. Ozone also carries the spark. These free radicals, reactive oxygen species, are already activated. They are carrying the spark. There is a normal flux of these in our body, which we need to live every day. There's bacteria all over you, in you, on your skin, everywhere. And your body is in harmony with these and keeps the bad guys in check. The good guys help you. You help the good guys. But your body is constantly making reactive oxygen species, including bleach, which are oxidants and will get the bad guys and generally leave the good guys alone. And this is how your immune system deals with infection.
So when we introduce ozone into the body, I've heard some people suggest, similar to your comment, that there's this oxidative influence of the ozone, and then ultimately the body mounts this antioxidant response. And so what happens to levels of glutathione, for example, when we're doing ozone? Do most people mount that antioxidant response, or are there some people that are unable to mount an antioxidant response for some reason?
Well, there's always going to be people everything is a bell-shaped curve. Everything. The studies that I've seen done by Germans and Cubans and others are that when you treat people with ozone, and Italians, Vilio Bocci, that the patient or the animal will increase their levels of glutathione. If you shoot ozone into a joint, and I do a lot of joints, osteoarthritis, with stunning results. You reduce inflammation in the joint. The patient sometimes gets better with one treatment. Sometimes they need many. And there's some bell-shaped curve, remember, that don't respond. They're at the far end of the spectrum, not a lot of them. And then there's some at the other end of the spectrum that do dramatically well with a few treatments. And then there's the broader group in the middle of the bell-shaped curve. So yes, I expect ozone to increase glutathione levels because of its induction of enzymes like glutathione peroxidase.
So let's talk a little about the primary goal of using ozone. Is it to deliver oxygen to the body? Is it to reduce microbial populations? Is it to increase mitochondrial function? What's the goal of introducing ozone into the body?
The goal is to help that person's physiology work. That's the goal. Now let's talk about the mechanisms. You might know I published an article on Ebola several years ago.
Saw that, yeah.
We had 5 cases. The government shut us down because of pharma. The world should know that. They were threatened. At least this is what I'm told by an insider. And pharma was really concerned that if we were successful, and they knew we would be, that pharma could have a lot of problems with something that's relatively inexpensive to do the way we were doing it. But here are the properties of, let's talk about Ebola for a second. Ebola is a stealth virus, and it's pertinent to the mechanism of ozone. Ebola is a stealth virus. The body doesn't know it's even there until it's multiplied, gone all over the body, infected all kinds of cells everywhere, and then the immune system finally responds when it wakes up with ballistic missiles. And it just blitzes everything. And your own body gets damaged and you bleed. That's called hemorrhagic fever. So ozone, and so you don't get good circulation. You're bleeding, you think you're getting good circulation. You're not. You're getting horrible circulation. Ozone works as follows. It improves red cell flexibility because of a direct effect on the red cell membrane. So it improves what's called blood rheology. Your capillary, will say, is this big, but the red blood cell is a little bit bigger, and it has to squeeze to get through. If it can't squeeze, it's inflexible, and blood backs up, and you don't get good circulation. Ozone helps that. It's called rheology. It also has been found to improve a compound called 2,3-DGP in the red blood cell. And that shifts the oxygen hemoglobin curve so that the red cell can actually release the oxygen it's carrying. If it doesn't release if you're on a train and the door doesn't open, what good does it do to get you to the station? So this is the door opening to get the oxygen out. Ozone also appears to improve oxygen consumption because you get higher levels of oxygen in the arteries and lower levels in the veins when you do ozone therapy. So you get a greater difference of oxygen before and after, meaning that oxygen had to be consumed. The only place that happens is in mitochondria. So somehow it's stimulating mitochondrial combustion. The next way is it modulates the immune system through the induction of cytokines and interferons, which is how the immune system talks to itself. So if your immune system is out of balance like this, ozone tends to bring it back to balance like this. And if you're out of balance the other way, it brings it back to balance. That's called modulation.
And is that balance that you're talking about there, is that TH1, TH2, or is
TH1, TH2, yes. And in most people, they have a problem with too much TH2 and too little TH1. And autoimmune diseases is possibly too much TH2 for a reason, and it helps bring it back into balance. And then the final way is ozone has a direct effect on killing microbes. Now, you're going to say, well, how does it kill a body-wide infection when it only lasts microseconds in your blood? Certainly, there's not enough time for ozone to last. If you give it in my vein here, it's going to be long gone before it gets further along. Ozone creates molecules called ozonides, which themselves are reactive oxygen species, but much less reactive than ozone is. Ozone is gone instantly. These ozonides are much longer lasting, and while ozone might not make it directly to the infection, the ozonides will. And they have the capability of oxidizing certain factors on the pathogens and acting as germicides. This is how I see it.
So when we look at chronic illnesses, many people have low oxygen perfusion or low circulation. You talked about the red blood cells being able to get deeper into the capillaries. Does this improved blood flow then help anything else a person might be doing from a treatment perspective to work more effectively? Meaning if they're also taking herbs, it's now reaching deeper places in the body, correct?
What is the most important thing to the body in all parameters?
Oxygen.
What'd you say? I'm sorry, I missed it.
Oxygen?
Yes.
Yeah.
Bingo. Oxygen is. You can't live with oxygen for more than 3 minutes. In fact, you'll have brain damage beginning in 60 seconds if you don't have oxygen. That's everything. Oxygen is necessary for energy, for the body to make its energy. And if you can get more oxygen into the body and stimulate combustion of oxygen to make energy, I can't see any downside to it at all. That is the most important thing. Everything boils down to oxygen delivery, diffusion, and combustion and conversion to energy.
So the immune modulation component that you just talked about in terms of ozone, I think that's a critical thing to understand as well. Many people with things like Lyme disease think they need to boost their immune system, but in fact, that's not often the case. Oftentimes there are these hyperactive and maybe some underactive aspects of the immune system that really needs more balance. And so what you're talking about here is modulation, not so much boosting, correct?
I think modulation is probably the best word for it.
Okay.
Because let's say this portion is low. Well, you're going to end up boosting this portion. And if this portion is too high, then you'll bring it down. The process is called modulation.
So even those people that have inflammation from an overactive immune response or autoimmunity, it sounds like ozone potentially is helpful in those cases as well.
I think ozone therapy is the cat's meow for autoimmunity. In fact, I have a paper in publication right now that hopefully will be published on a case of lethal dermatomyositis. My patient was basically dying on 4 high-dose immunosuppressive drugs. And I used ozone, and I found the source of the problem, which was an occult dental infection, which none of his doctors picked up. And we took care of the infections and treated him with ozone, and he's alive and well today with no trace of the disease. And when I saw him, he was on about 120 milligrams of prednisone.
Wow. That's amazing. Yeah, that's, I definitely, ozone has been one of the things over the years with my own health journey that I have found very helpful and been very drawn to as well. What does ozone do to the microbes themselves? Let's say someone with Lyme disease and they maybe have Borrelia and Bartonella and Babesia and all these other things, viruses and so on. Does it eradicate the organisms from the body? Does it reduce the populations enough that then the immune system is able to manage it long term? Or does someone need to do ozone therapy kind of in a maintenance rotation over a period of time to kind of maintain those benefits?
My own belief is a combination of things. And based on what I told you initially regarding Ebola, the most important thing to the body is oxygen. Where you have infection, the white blood cells need 50, maybe even 100 times the amount of oxygen that they burn at rest to surmount the infection. That's a tremendous amount of oxygen. And medicine totally ignores this fact. So there's people languishing in the hospital, whereas if they just got intense oxygen therapy, it would help them recover from infection. So the immune cells need oxygen because they're generating these reactive oxygen species to fight the infection. White blood cells make bleach. They make superoxide. They make oxides of nitrogen. They make and they make ozone to throw at the pathogens. So that's one way it can help. Ozone, if you have Lyme disease, say in your brain, the ozone is not going to make it that far. It's gone in microseconds, as I said. But what remains is the ozonides, which are still strongly oxidizing compounds, longer lived. And this is my belief. I believe that they will have a toxic effect on microorganisms. Why? Because we know that ozone destroys microorganisms in seconds, maybe less than a second. You expose a bug to ozone, and it's like you getting shot with a shotgun. That's what ozone does to the microorganism. Well, the ozonides are less powerful than ozone, but they're oxidants nevertheless, which is what your immune system is hurling at the organisms. So I do expect it to lower the number of organisms, which may enable your own immune system, which is weakened for whatever reason, to begin to overcome. Plus, you're getting more oxygen to the system. Plus, you're modulating the immune system. Essentially, from my perspective, you're awakening the immune system.
So we talked about balance of Th1 and Th2 in the immune system, but there's also a balance or a dance between oxidants and antioxidants. And I think oftentimes many people hear about, take this latest thing, this antioxidant that's going to quench all the free radicals. But the reality is we need oxidation as well. And isn't it true that we can, in some cases, get too many antioxidants, and especially when we have infections, that we might actually be causing ourselves more problems with antioxidants?
Well, if you recall, I said I believe the free radical theory is debunked. Mm-hmm. So, yes, it's been shown in studies, whether they're really good studies or not, that taking too many certain types of antioxidants might lead to an increase in disease. I don't believe in taking a lot of antioxidant supplements. I do think supplements are indicated. I use certain supplements. I use certain supplements perhaps to raise glutathione in targeted individuals. I personally take very few supplements. I only take supplements that I believe that I'm not getting those nutrients in my food. I'm an organic raw food vegetarian. I'm not totally organic, but close. In the summertime, I'm almost totally raw. And I'm not vegan. I eat some dairy. And I've checked every parameter that you can check in a person, in me, and they're all good, including essential fatty acids. and including the so-called need for fish oil, which I think is garbage because fish oil is highly prone to oxidation. And I think if you're taking fish oil and ozone, you're really in for a tough time, or you could be, because it's going to oxidize the fish oil and make it rancid. So the free radical theory needs to be set aside. We need oxidants. And I don't believe God makes mistakes. I told you that 5% of the oxygen that goes through our mitochondria gets converted to the free radical superoxide. 5%. That's a lot. That's not an accident. That's there for a reason.
Can ozone be used in protocols where people are doing other pharmaceutical, possibly antibiotics, possibly herbal antimicrobials? Are there any things that you can't use ozone with?
From what we have seen, ozone is not incompatible with anything that someone is doing.
And when someone is using ozone, and there's lots of effects, but you talked about the antimicrobial or microbial population reducing potential, do people have a Herxheimer reaction like they might have with an antibiotic or an antimicrobial herb?
They can.
Okay. And let's talk a little about the range of microbes that ozone may help with. So does it help with viruses, bacteria, fungi, parasites, or is it only helpful with a subset of those?
I think it's helpful with all of them. I mean, we knocked out Ebola in 5 out of 5 cases. No one's done that. The possibility of that happening by mere chance is less than 1%. Bacteria, I told you that there's good studies that ozone is a germicide. That's not an antibiotic. A germicide is something that outright kills, like bleach or hydrogen peroxide. Funguses, what do you use for funguses? If it's on your wall, for example, you use bleach and it takes it off. So oxidants get rid of funguses. Parasites, I'd expect something similar, but it depends upon the parasite. It depends on what you're dealing with, and can ozone get to it? Intestinal parasites, not a chance. Mm-hmm. If you're dealing with worms, there I use chemical treatment. But if you're dealing with bloodborne amoeba, or malaria, for example, is considered a parasite. Mm-hmm. Yeah, I'd expect ozone. Artemisinin is an oxidant, and right now it's still the standard of care for malaria, but the malaria is getting wise to artemisinin as well.
So malaria and babesia are somewhat related, both that they're parasites that live in the red blood cell. So would we expect that ozone would then be helpful for people dealing with babesia infections potentially?
I expect it.
Okay.
And I believe I see it.
Yeah. And can microbes become resistant to the effects of ozone like they can to a pharmaceutical antibiotic, for example?
You know, that's a really good question, and I've wondered about that for a long time. Certainly, there has to be some type of threshold for anything. A poison is made a poison by the dose. So, can microbes become resistant? Well, microbes have had 4 billion years to get resistant to the oxidant ultraviolet. Ultraviolet's an oxidant, and they're not resistant to it after 4 billion years. I have not seen any reports of microbes getting resistant to bleach or hydrogen peroxide. These work differently than antibiotics, which go into the cell and internally disrupt enzymes and mechanisms in the cell. These are like corrosives, more like corrosives to the organisms. I mean, can you get resistant to a woman's long fingernails going like this to you and scratching you?
Probably not.
Even if she does it gently and just steps it up over time, probably not. That's how I see this.
Mm-hmm. And so let's talk a little about biofilms then. So biofilms are this protective slime layer that exists in infections like Lyme disease, for example. Do we know if ozone can access microbial communities, or the ozonides potentially can access these microbial communities that are in a protected biofilm colony?
It has been published that ozone gas cuts through biofilm. It just slices through it. Published. And I have a case in publication now of a woman, first case in the world ever reported. She had 2 prosthetic hips, woman in around 60, and one of them got infected. And the doctors couldn't find the infection by culture, and that often happens with biofilm. They're culture negative. And they wanted to cut out the prosthesis and leave her with a flail hip, not joined. And so she would be laid up for months with impregnated antibiotics in the joint rather than a hip, and intravenous antibiotics. And this is how she was going to have to be for 3 to 6 months. Yeah, tough. She heard about me, came to me, and the hip joint was swollen. And I treated her with ozone directly into the joint, into the prosthetic joint. I gave her high-dose ozone by blood, sent her back to where she came from, where she continued to get the ozone. Very shortly thereafter, the doctors were able to culture 2 mouth organisms from her hip. I'll get to that in a moment. And now that it was culture positive, they put her on a type of penicillin orally and told her, we need to cut out your hip, we need to cut it out and get you on antibiotics immediately. But she was already significantly better with what we did, and she continued. And she took the oral antibiotic, and within 30 days of the antibiotic, she was fixed.
Wow. This
is the first case in human history where a septic prosthetic joint has been cured without some sort of surgery and or intravenous antibiotics. Septic joints are biofilm communities. So here we have a case, it's in publication now, that we've actually seen it. So yeah, I do expect it to work. Now, if you're dealing with a biofilm, I do believe you have to get the gas into the biofilm. In other words, I don't believe that simply treating her blood would have done the job. And still, you really need to try to drain the infection if you can. In her case, I think we got really lucky. I do believe in debridement and draining abscesses. And this is essentially an abscess. But for whatever reason, we got lucky, and by shooting ozone right into it, we probably broke up the biofilm, which enabled the antibiotic to work. Now, why was it oral infection, oral organisms? I think one of the reasons why our clinic gets fairly good results is I look for reasons why ozone might fail. And I'm always looking for dental complications, which include root canals, cavitations in bones, hidden dental infection that you don't know about, because these can seed the body and they can interfere with acupuncture meridians and really screw up bodily functions. So she comes in, and I have to think, well, why did she end up with an infection? And I take in oral history in everybody, and she had root canals, and she had a root canal particularly in tooth number 6. 6 is a canine. And the canines are in the liver meridian, and the liver meridian controls the hip. So that very tooth that you pointed to there, yes, the canine, the eye tooth, I believe was infected based on my exam. I sent her to a local dentist who told me that the root canal was infected. And I said, get it out. And she did. She went to Southern California. She got it taken out. And lo and behold, the organisms that showed up were oral organisms. So I think that the infected root canal that she had was seeding her body, and it ended up in the target meridian system, which controls the hip. And that's why she ended up getting it.
Yeah, I think the whole dental pathogen question is an important one for people with systemic health challenges, because I think that's definitely true. And I know there's been research even in Alzheimer's where they found dental spirochetes in the brain as well, right? So these dental pathogens don't just stay in the mouth, unfortunately. Do we know if ozone has an effect on beneficial flora in the body as well as the dysbiotic flora? So does it potentially reduce our healthy populations of bacteria?
Potentially, yes, potentially. But generally, these are aerobic organisms, are the good guys, meaning they can deal with oxygen. So they'll be more resistant than the bad guys. This is from my perspective. And they'll have a better propensity to recover than the bad guys. So I'm not worried about that at all. None of us have seen problems related to that.
I know with hyperbaric oxygen therapy, some people have suggested that Babesia could potentially benefit from the oxygen. I don't know if you agree with that or not, but I'm curious, are there any microbes in Lyme or otherwise where ozone may actually benefit a pathogenic organism?
I can't speak with science from that. I try to do my medicine based on logic.
Okay.
Your white blood cell needs oxygen. And if you're going to try to deny oxygen, an optimum level of oxygen, thinking you're going to feed the microbe, and we know that your white cell needs it a hell of a lot more than the microbe needs it, I think it's a mistake to go in that direction.
Very good. Does ozone play a role in detoxification? Is it able to help the body break down certain toxins like heavy metals or other chemicals, pesticides, things so that they can be more easily eliminated from the body? And do we need to heighten our detoxification support when we're using ozone, for example?
I believe ozone itself is a detoxifier. Now, does it break down metals? No, you can't break down metals. They're the basic poison. You can eliminate them, but you can't break them down. There's no way to break down mercury. It's an element. But you can do things to help bring it out, like chelation. Now, one of my friends believes that ozone does chelate out heavy metals. It is known that oxygen compounds can chelate metals. I don't consider ozone a metal detoxifier. I haven't seen absolute proof that it's doing that. Might it assist the body in doing it? I would say yes, because it's inducing glutathione, which does bind heavy metals and eliminate metals from the body. So yes, I could see it doing that way, but simply grabbing the metal, friends of mine say yes, I'd like to see proof, but it doesn't matter to me. And now, with regard, you asked about chemicals. Mm-hmm. I would believe that ozone is going to initiate some type of breakdown product of chemicals. We're all loaded with chemicals. These are industrial chemicals. A lot of them get stored in fat tissues of the bodies. They can go on and cause cancer, immune dysfunction, etc. And the body has a lot of difficulty eliminating them. Once these chemicals are oxygenated, they become more water soluble and they're more free to get out of the body. So one of the ways the liver gets rid of these chemicals is by oxygenating them, and they become water soluble. But it's a hard process for the liver to do that. The ozonides, I believe, have the ability to oxidize some of these chemicals and hopefully to mobilize them. And I think there is some basic evidence that might happen. In the case of animals, sorry for interrupting, in the case of animals, the Cubans did a study on chloroform, which is an extreme liver poison, and they pre-medicated the animals with ozone before they exposed them to chloroform. And if they pre-treated them, their survival rate was much greater, simply by pre-treatment.
Do you generally utilize any detoxification supplements or tools along with ozone when you're working with someone with a chronic systemic condition, or do you find that's generally not necessary?
I do. I can't tell you which ones because it varies from person to person.
Sure.
It depends upon how I feel intuitively, and I use kinesiology.
Mm-hmm.
That's how I do it. It's subjective, but it helps me.
I 100% agree. I love it.
Okay.
Good stuff.
It's guidance for me on what might work best for somebody.
Yep. Let's talk a little about water damaged buildings. So many people with chronic health challenges are living in a water damaged building, getting exposed to mold and mold toxicity. There's the potential, and this is debated, but there's the potential for some colonization of some of these organisms if you're constantly breathing them into your sinuses, for example. Do we think that ozone might play a role in helping the body to either reduce colonization of these environmental molds or in some way to help the body detoxify from the effects of exposure to mycotoxins?
I think so. I lived in Alaska for 22 years. Big mold problem because we had water everywhere during spring breakup. So I saw scores of people, maybe hundreds of people. And I was using ozone and hydrogen peroxide. And yes, the people generally got better. We use ozone to decontaminate mold in where there's contamination. I do shoot ozone into sinuses. You can't breathe it into your lungs. It's very hard on your lungs. You never want to do that. But blood treatment, I think, helps the immune system. I think you can treat sinuses and possibly break up biofilm that way. So the answer is yes.
Are there any supplements or nutrients that one should avoid around the time that they're doing ozone therapy so that they're not canceling out or reducing the effect of the oxidative component of this type of treatment?
That's been a storm going around like this for a long time. I never told anybody to stop taking anything. In fact, Howard Robbins has people taking vitamin C around the clock, and he thinks he gets better results. And some people believe vitamin E might be a problem, but I never saw it.
Okay. And what are some of the different ways that ozone can be introduced into the body? So can you talk a little about how you do this in your office? Do you do direct IV, major autohemotherapy, insufflation, sauna? What are some of the different ways we can get ozone into our body?
Our favorite way is what's called hyperbaric ozone therapy, where we take blood out, and let's say this is the bottle. So we take about this much blood out, and it goes into a bottle. Then we add ozone oxygen mixture under pressure, and the blood goes back. And we can repeat it as up to 10 times. For years, we just did 1 or 2 passes. Then we learned from a European doctor about 10 passes, and I had that last night. I do it once a month for prevention. And that improved our results with Lyme dramatically. We were getting good results before. Now I think we're getting great results. So blood treatment is one. There is a gravity method of major autohemotherapy, which I think is a rather poor method. I don't like it. I didn't see good results with it, but it's the majority of what the majority of doctors are doing.
So that's a similar process to what you were talking about, but without the pressure?
Without the pressure. Okay. It's a slower process, goes in by gravity. I don't think you get as much ozone, and I don't think you get as good an effect. My mentor on DIV, Howard Robbins, says DIV is the cat's meow, but that's until he met me doing the hyperbaric procedure. Now he agrees. Hyperbaric ozone is the cat's meow, with DIV being a second.
And DIV, for those people listening, is when you inject the ozone directly into the body, correct?
Yes, direct intravenous gas. That's DIV. And that's what he does. And it's highly effective. It is the most cost-effective means of delivering ozone. I do very little of it because it's hard on veins. So that's the main reason why I don't do it. And sometimes it can cause some chest tightness too, but that goes away. But when you lose veins, you lose veins. And Howard doesn't deny that that happens. So we don't do a lot of that. You can administer ozone into joints. Phenomenal results. You can administer it into soft tissue, tendons, ligaments, muscle if you need to, under the skin. You can do cosmetic ozone to help with collagen. I said you can even shoot it in your nose as long as you don't carry it into your lungs. You can put it in your mouth. For oral problems, women can take it vaginally. And one of the most common ways of taking it is rectally, putting a catheter in your rectum and taking the gas. That's cheap, easy, and very safe to do. It's not nearly as effective as blood treatments, but it works. You can make ozone water. You can put ozonized oil on your skin. We have put it in the bladder for cancers. And you can drink ozone water for mouth, esophagus, and stomach problems.
So let's talk a little about 10 pass ozone. So my understanding is that up to 10 passes can be done in a session. I know my understanding is sometimes people have to work up to that not everybody goes right to 10. But let's say that they're at 10 passes in a session. How many sessions does one generally need to do? And what's a common response to treatment in something like Lyme over a period of X number of sessions?
I'm going to recommend people go to my YouTube channel. YouTube channel is my name, Robert Rowen, MD, all one word, no spaces. Just go to the channel, and you'll see hundreds of patients who have had ozone therapy, including a section on Lyme and infectious diseases. The usual response is if you have brain fog, you wake up right on the chair. Not 100%, but it's a usual response. Lyme generally gets better, a lot better, within 6 treatments, and sometimes on the first couple treatments. We've only had a few people not have good results.
And when you say a treatment, just to be clear, so is a treatment a 10 pass?
10 pass treatment.
Got it. Okay. Perfect.
Now, before we were doing 10 passes and we were doing 1 or 2 passes, we got good results, but it took longer. What might have taken 6 to 10 treatments before, we now see in 1 or 2.
You mentioned the issue about the potential for damage to the veins in direct IV. Are there things, if someone has had that experience and has some vein injury from ozone, is there something that can be done to improve that situation? And or are there things that can be done to minimize that potential? I mean, it sounds like not using direct IV is the one way to
use
minimize
direct IV. I mean, if you use intravenous hydrogen peroxide, which I used to do, and once in a while we still do it, it's hard on veins. That's well known, and it's the same mechanism of action as DIV ozone, and it just scleroses veins. Now, I did something stupid once in my early days. I gave myself, in these gorgeous hand veins right here, I gave myself an extraordinarily high concentration of ozone by DIV gas. And the vein clotted off, got very painful, and I thought, oh my God, I'm going to lose my hand veins. It could damage my hand. And I was scared. And I always do things on myself before I do it on other people. That's why I did it. You know, I was getting ready to treat some AIDS cases. And I put castor oil packs on them immediately. And I also took some enzymes, proteolytic enzymes. And in 3 days, I could see blood moving through again. So yeah, there's things that can be done.
Awesome. So let's talk a little about insufflation again. So my understanding is that some of the Cuban studies showed that insufflation is quite effective as compared to some of the other ways that it might be administered. Maybe not as effective, but that if people are consistently doing insufflation, that it also can have a significant effect. Is that your experience as well?
I think insufflation works, but I'm not going to even venture a guess as to how many insufflations equals one blood treatment. I think it takes several. And I think I get better results with blood treatment. You have to realize, the Cubans were great. They did good studies, and they had really good scientists. But there's not a lot of money there. And they're going to go with rectal because it's a lot cheaper to do than it is getting the equipment for blood. I don't blame them. And it does work, and that's what they largely studied. In this country, we generally do blood treatments. I do have my patients get machines so that they can do rectal at home to continue the results. But I had a woman come in with Lyme disease. She really wanted to get pregnant. She was about 31, and she was desperate. And we did ozone on her, and she got a lot better, and I sent her out to do rectal. And she continued coming in once every 1 or 2 months to continue getting blood ozone, because she says she felt that much better with the blood, even though she was doing rectal. The good news was within a couple of years, she met a guy, and went off, and I think she's a family woman now.
Nice.
So that's good.
So let's talk a little about ozonated water. I've heard that debated a lot over the years. Is there a benefit to it? Is there not? I've heard some people recently suggest that it might be helpful in those people dealing with small intestinal bacterial overgrowth or SIBO. What are your thoughts on ozonated water?
I like it, and I have patients tell me that, a lot of patients tell me they feel better straight off the board drinking ozonated water. Some people say no, but I like it. I think for mouth conditions, it's great. For esophagus conditions, it's good. For stomach conditions, and I would use it for SIBO as well. Ozone is not going to make it all the way down to the small intestine. It's probably going to react long before it gets to the small intestine. But remember, it's making ozonides, more stable molecules, and those will get passed down, and they may have a harsh effect on the organisms.
In many people dealing with biotoxin illnesses, the topic of MARCoNS or staph in the sinuses has been discussed, especially in those people dealing with water-damaged buildings or Lyme disease. This MARCoNS is a common topic. Some practitioners also talk about fungal or mold colonization in the sinuses. Do you feel that ozone potentially has an effect on these MARCoNS or staph-type organisms in the sinuses?
I do, and I would give ozone up into the nose, and I would give ozone the way we do it, hyperbaric into the vein.
Mm-hmm. Very good. Yeah, unfortunately, it seems like that's an organism that people can treat and then retest, and oftentimes still see it showing up in the testing. And so it's good to have some other tools potentially like ozone. Do you have any thoughts on the role of ozone in those people dealing with dental cavitation? So the dental cavitation topic is a big one that I've heard about for years from Dr. Klinghardt, who was one of my mentors. You've been a voice in the cavitation and root canal arena as well. Do you think if someone has a significant cavitation that ozone by itself can resolve the cavitation, or is it still the case that surgery is potentially required?
You better talk to a dentist about that. I'm not a dentist. I do know dentists who shoot ozone into the cavitation, and they say that it helps or it might resolve it. But typically, if I know there's a cavitation, I want it surgically excised and use ozone.
Very good. And any thoughts on using ozonated olive oil, either taken orally for parasites in a capsule, or using ozonated oils in terms of oil pulling to reduce the dental pathogen population?
Sure. Do both.
Okay, very good. You talked a little about injecting ozone into joints, for example. Now, is that similar to prolozone?
Yes, the term prolozone came from a combination of prolotherapy and ozone. And prolotherapy involves the injection of substance to cause an irritation. I was doing prolozone since 1986, even though I did not coin the term. Frank Schellenberger coined the term, but I did joint injections with patients with apparent Lyme disease in knees back then, and it got better. Yes, the common term is prolozone, where you're shooting ozone in place of prolotherapy into joints and connective tissue.
Is there any reason, and I think I know the answer because you just said you gave yourself ozone last night. So is there any reason not to use ozone on an ongoing basis for health optimization? Are there any downsides to long-term use? I mean, to me, it sounds like it's almost an anti-aging or healthy aging strategy if you use it over a long period of time.
I like your term healthy aging. I was calling this anti-aging, but I like healthy aging better. I want to be healthy till the day I die. You know, we're all going to die. I want to be able to mountain bike, garden, hike, backpack, treat my patients, make love with my wife. I want a quality body. And I see no downside to ozone, and I take it regularly, and I see a major upside. Ozone increases the activity of an enzyme called superoxide dismutase. And SOD is intimately connected with the enzyme telomerase. Telomerase is what keeps the end caps of your DNA healthy. And as your telomeres shorten, your DNA strands age. So you want a good level of telomerase. Now, you're going to say, well, what about cancer? Well, cancer is abnormal. It's got an endless production of telomerase. So that's totally different than what we're talking about in normal cells. So if I can get SOD up and it happens to induce healthy levels of telomerase, I'm talking healthy levels of telomerase, then this is something I want to do. And there are some articles that SOD does this, and I know that ozone induces SOD.
I know that it's becoming easier to measure the length of the telomeres with testing these days. Is that something that you've looked at with someone that's done ozone before and after to see if you do see, yourself? Okay. And you obviously saw that there was some significant benefit, it sounds like.
Well, at the age of 60, I measured my telomeres, and they were the length of the average 35-year-old.
Wow. Yeah, which is amazing because I've also seen, the opposite. I had a conversation recently with someone that was dealing with Lyme that was probably in his 40s and found that his telomeres were closer to 70. So that's pretty remarkable. With all of the potential benefits of ozone, why isn't ozone used more in this country?
Well, I'll explain what happened in Sierra Leone. We're going to be running out of time soon, but the world needs to know this. I go to Sierra Leone. I risked my life, literally, and I was willing to do that because I wasn't worried. I knew I had ozone with me. If I got Ebola or exposed to it, I would have just treated myself with DIV, which we did. We treated ourselves every day with DIV. And I get to the Ebola treatment center. Howard Robbins, my colleague, had already left by this time. And I'm training the doctors how to do it. And a call comes in from the Minister of Health or the Ministry of Health. It's the Assistant Minister of Health. And it tells the military man in charge of the treatment center, it's a government treatment center, if you value your job, there will be no ozone therapy at the center. Well, when I was told this, I lost it. I have a really cool temper. I don't lose it. I lost it. I just went ballistic. I said, people here, right here in this room, are going to die. I said, to me, this is a crime against humanity. It's an unlawful order. It's illegal, etc. And 10 minutes later, the call comes in from the Minister of Health to close it down. Well, so the guy in charge says, well, we're not going to treat patients. We have an order, and he's a military man. But he was concerned, rightly so, about everybody working for him. So they lined up to get treatments as part of the training session. So we treated everybody. And I left. I felt like I got kicked in the nuts. And I'm being blunt because I just was blown out. But I knew something bad was going to happen. And sure enough, it did. One of the doctors that I trained stuck himself with a needle. 3 weeks later, we get a call that he's getting symptoms. And he was terrified of letting anybody know because he would have been thrown in the containment unit and denied treatment. So he got to our group, got ozone and recovered within 48 hours and went on to continue treating people and spiriting in ozone water, ozone for rectal. And he actually was able to get the mortality rate down significantly. Now,
so did he survive?
Oh, yeah. I said he recovered.
Oh, he recovered. Okay.
In 48 hours. He was 48 to 72 hours. He was back at work. That's unheard of with Ebola. Unheard of. Because once you get symptoms with Ebola, you collapse. You're gone. And there's a 60% risk of death at that point. So another guy gets it, another doctor, a guy named Salia. So our group goes to him and says, would you like to get ozone? And he had just gotten some antibodies and was feeling better. So he said, nah, thank you. He was polite. And about 12 hours later, he reversed and got worse again. So they air evacuated him to Nebraska, where he promptly died. Now, Sally's first test was negative. So unfortunately, they broke protocol and they gave each other a hug with another doctor. And Sally 2 days later is sweating Ebola. Well, the other doctor got contaminated. He got Ebola. His friend Sally dies. So he agrees to get ozone. His test is positive, and he recovers in 2 to 3 days. Another guy that we treated, that I trained, got Ebola, and the government denied him treatment because he tested positive, and they refused to give him ozone, even though he begged for it, and they hauled him away in a paddy wagon, and he eventually died. And that one breaks my heart. That just tears me to pieces. And then 2 more aides got exposed to Ebola, and they got treated with ozone before their tests came back positive, before they were quarantined, and they survived and did well. And then the last one was the female consort of their most famous physician, Willoughby. And Willoughby got it, probably stuck himself with a needle during surgery in an Ebola patient. We went to him, and he's a very conventional doctor. I am told he was quite stodgy, and he cast us off. He wanted ZMapp, a pharmaceutical, and it was flown in from Europe. And while he was waiting for it to thaw out in the middle of the night, he died. His consort begged him to get ozone, and he refused. She's placed under military guard at her home with 2 armed guards in the front. No one can get out. No one can get in. So she's under quarantine in her own home, and she's scared to death. We can't get in, so she climbs a razor wire fence in the middle of the night to get to our people, and she gets treated. And at the time, I was told she didn't develop any symptoms. But a year and a half later, I got sent a handwritten letter from her thanking God for ozone, because she too was symptomatic and she was scared to tell anybody, fearing if she did, she'd be thrown in the pen too without treatment and left to die. So that's our story. Now, I found out about 10 months ago, from somebody on the inside, that the pharmaceuticals went to the World Health Organization, and the WHO then went to the government of Sierra Leone and told them to stop the ozone project, or pharma would withdraw not only from Sierra Leone, but from all of Africa.
Wow. So the answer to the question is that it's a political reason more than anything, and a dollars financial reason more than anything.
It's farming people for profit, and willing to make a buck by letting people die. That's how I see it.
Yeah. So my last question as we wrap up for you, same question I ask every guest, and for you probably other than ozone, because we've talked about that, but what are some of the key things that you do on a daily basis that are really supportive of your own health?
I told you I believe in 3 major things, or I didn't tell you, I'll tell you now. Proper nutrition, the 3 things that cause disease: improper nutrition, toxins, and stress. So I eat right. I eat a pristine diet, with a couple exceptions that I told you. I do eat some organic dark chocolate, and I like ice cream. That's the extent of my dietary indiscretions. Period. End of story. That's the extent. So I eat right. I avoid toxins. I do things to detoxify, which might include saunas or ozone. And I do meditate, and I try to commune with the universe to reduce my stress, which is very high. And I do get exercise every week. I take a nice long hike and try and work up a good sweat. And I tend to a small orchard, and I just try to be active.
And you're living your purpose and passion and doing the work that you do every day and changing other people's lives. So it's been really informative talking to you. I have looked up to you and your work for many years. I appreciate the opportunity to have you on the show and just appreciate the passion that you have for helping other people. So thank you so much for spending time with us today. I really appreciate it.
Thank you for having me. I hope it helps people. Please let me know.
Thanks so much, Dr. Rowen. Bye-bye.
Bye-bye.
To learn more about today's guest, visit docrowen.com. That's Doc, D-O-C, Rowen, R-O-W-E-N.com. docrowen.com. Thanks for your interest in today's show. If you'd like to follow me on Facebook or Twitter, you can find me there as Better Health Guy. To support the show, please visit betterhealthguy.com/donate. If you'd like to be added to my newsletter, visit betterhealthguy.com/newsletters. And this and other shows can be found on YouTube, iTunes, Google Play, Stitcher, and Spotify.
Thanks for listening to this Better Health Guy blogcast with Scott, your Better Health Guy. To check out additional shows and learn more about Scott's personal journey to better health, please visit betterhealthguy.com.